our Vermont school nurse, Katie Burke, who got us in touch with Cynthia Kemish, our special speaker for today. It is afternoon where Cynthia is, and she was sharing with us before you all came on that her students have left for the day. So Cynthia is a school nurse in the International School of Zug and Luzern in Switzerland. She has organized an international group of school nurses who collaborated on their back to school efforts. Cynthia started school on May 11th, and she's here to share with us her valuable insight and experiences. And Cynthia, thank you so much for being here. We are very anxious to hear what you have to say. Welcome.
Thank you very much, and thank you very much for the invitation. I would certainly encourage anybody to have, if they have questions, put them in the chat box. I like really challenging questions, and if I don't know the answer, I will happily say I don't know the answer, but we can always look to see if we can find the answer. So what I'm going to do is talk to you a bit about how we as a school have opened up in Switzerland with children returning after our COVID-19 lockdown. And I have a presentation that hopefully won't take too long to go through, but really it's to set the concepts that's seen in Switzerland and really put what we're doing in focus with what's happening in the country and why Switzerland have chosen to do it in this way. So I am going to share my screen and I'm just going to move my mouse out the way. So my name's Cynthia Kemish, and I work at the International School of Zug and Luzern. I've worked here for about 18 years now and have seen the school grown from about 250 students to we have 1,350. Just to, again, as I said, we're going to try and put this in context, and I'm sure you all know where Switzerland is, but what I really want to focus on is the countries that are around Switzerland in terms of this COVID infection as it spread through Europe. And Switzerland borders with Italy, and Italy had huge cases in the very north of Italy, about 10 kilometers across the border with Switzerland. So not only Italy had a lot of cases, but also France had a huge number of cases. And the second map on the right, we come from Zug. We're in Canton Zug. We're right in the heart of Switzerland, the smallest canton. A canton is like a state, so we have our own government that rules us, as well as a federal government that rules the whole country. And to give you an idea what Zug looks like, this is Zug. We're not a big metropolitan area at all. We are mountains and countryside and lakes. So we are not a big city. This is our two campuses we have as a school. I work on the Zug campus, the top one for primary and middle school. And we have about 940 students there. And we have another campus about 15 minutes away for the high school with about 350 students on that campus. And on average, we have 20, sometimes 21 students in a class. So as I mentioned before, it's going to be quite important to try and have it in context, because what I've realized when I speak to other nurses in other countries is that you have to look at each individual situation, and you will have to do that not only for your own country, but also for your own states as well. And one of the most key things that I think has allowed Switzerland to go fairly quickly forward is that if you look and see on February the 26th, we had the first case in Switzerland. And within 2 weeks, on March the 13th, they had gone into what I would call a soft lockdown. So schools were closed, non-essential shops were closed, but people were allowed outside. You could go out and walk, but you should be keeping yourself isolated as you could. People were asked to work from home as much as possible. They cut back on public transport as people weren't really using the public transport. Going through the timeline, so from March 13th, where schools closed, on May 11th, the Swiss said we could open up compulsory school age schools. So compulsory school in Switzerland is between 5 to 14 years, and then after 14, the majority of Swiss students will get apprenticeships and continue their education in an apprenticeship setting, and about 5% will carry on into higher education and then go on to university. As I mentioned, our cantons or our states each had a slightly different approach to it. So the federal government came back and said compulsory schools can open, but different cantons then interpreted that on how they were going to do that. And for us as a school, we decided that we were going to do a soft opening as well, because the Swiss government had said all primary schools can just come back full classes. And this was at a time when there wasn't quite so much data about the impact of age and the virus. And for every piece of research I read that said that children weren't so severely affected, there was another bit of research that said we can't assume this. So as a school, we decided to open on a soft opening. So we had half-size classes where children were coming in Group A, Monday and Tuesday, 10 children in the class. Wednesday was home learning, and Thursday, Friday was Group B. So we actually had in-school learning taking place and still at-home learning taking place as well. And that was really challenging for the teachers. And I certainly have to, they're amazing in what they managed to do in this time frames. On May the 25th, we then went to full primary school opening. So we have now full classes, and our middle school opened. We were allowed to open the middle school on May the 11th. We had a slight problem with one of our buildings. We needed to check that actually the ventilation system was okay for us to open up. And so we kept those students at home learning for 2 weeks longer. But they have now started to return, and we're doing this, what I would call a soft opening again, where the children are coming back in a grade for a day each. So they're basically doing 3 days back in school over a 2-week period. And this is to help them learn the new rules and to help the teachers. It's been very hard for the teachers who have been in lockdown for 2 months to then suddenly go, oh, it's okay, everybody can all come back and everything's going to be fine. June 8th, the high school can open. We found out yesterday that yes, we can open the high school. The challenge is that everybody at that age has to maintain a 2-meter distance from each other. And we haven't quite worked out yet what we're going to do as a school, because space will be a challenge for us with these rules. So in Switzerland, we're a population of just under 9 million, and we have had over 30,000 confirmed cases. Of that, there's been 1,917 deaths as of the 23rd of May. Of all the tests that were taken, 10% of them came back positive. And Switzerland wasn't particularly quick at doing testing. They really only started doing the testing with those that ended up in hospital. It was a struggle to get the tests done, and they really weren't doing any contact tracing. They tried for about the first 2 weeks, and then they just couldn't cope with it, so they stopped trying to do the contact tracing. We've had no recorded deaths of anybody under the age of 18 in Switzerland, and actually no one under the age of 30. And that's quite important when we look at the concept that the Swiss have gone with and the impact of COVID with students. Interestingly, I looked at this case fatality ratios, and the US is doing better than Switzerland in terms of the numbers. So you can see there 0.062 number of fatalities per case, whereas the US it's 0.059. And currently there are just under 500 people in hospital, 50 in intensive care, and just under 20 people ventilated. So it's just really to get an idea of the numbers in Switzerland. So the Swiss concept for children in school and coming back in COVID is that they put out a statement that they felt that children under the age of 10 have a very low risk of spread or degree of illness of the COVID. And as a consequence of that, they said there was no need of social distancing within a school setting. So child to child in a classroom, there is no need to social distance. What they have said is that children over the age of 10, you start to see an increase in the number of cases year on year. And so there's an expectation that you would start to introduce and educate social distancing with this age range between 10 and 14. Over the age of 14, again, we see the risks continue to increase. They don't know why, whether this is behavior or physical development of the children. But from 14 upwards, they would expect those students to maintain a 2-meter social distancing within the school setting. So why does Switzerland think that? So these are the numbers from Switzerland, and these are the actual numbers that we've seen. So down the left-hand side, you can see the age, 3, 4, 5, 6, 7, and next to that, you can see the number of cases that we've seen for each age of child. And actually what you see is up to about the age of 10, there are no more than 20 children in each age category there. And as you go on, as each child gets older, you will see the number increase, and particularly at this 15, 16, 17, 18-year-old, you start to see the numbers go up. And this is what has informed the Swiss on their return to school policy, that children, they may be getting it, but they are not getting it so dramatically that they can quite easily be symptom free. They question whether they are actually transmitting it in the same way that an adult would do. And so this was a statement that came out from the Swiss government that said, this is what, no, this one, sorry, wasn't the Swiss government. This is from the Swiss Society of Pediatrics that informed the Swiss government. And they had these 3 studies that demonstrated this idea that children were not the vectors or not hugely affected by the virus. And I will share the presentation, and then you can click on the links yourselves if you wanted to have a look at each of those studies. May the 10th, the day before we actually opened our schools to students again, the WHO also put out a statement saying that the role of children in transmission remains unclear. However, there is evidence that serious illness in children is seen very infrequently. So that did help us a little bit with the confidence as well, because we, as much as the Swiss government seem to be saying something different to lots of other governments, so it does help when you have an organization like the WHO who is thinking along the same lines. So what have we done as a school? So we looked at this as with the leadership team, and I have to acknowledge our leadership team who've been amazing and have included the nurses in every single meeting with this, and have listened very carefully to our advice and suggestions. And as a school, we have said health and wellness and safety are our top priority. That's number 1 in terms of bringing the students back. Our continuity of learning plan anchors us. So our home learning was working very well. We had about 80% satisfaction rate with the home learning in this situation. And so we didn't want to rush everybody back to school unless it was actually going to be better than the home learning situation. And so that's why we've had these couple of weeks where we've had half classes and online learning still happening at home. The other important part is that our plan needed to be flexible and adaptable, because we don't know, at any time we might have a sudden spike in cases and they say, right, as a school we need to go back to distance learning, and so we need to be ready and prepared to do that. And we wanted to offer the families a choice. So as a private school, we were able to do that. The local public school, the expectations was that all parents should send children back to school. Again, there's a link there into our school document that we sent out to families about the reopening on May the 11th. So I'm going to talk a bit about the Swiss key strategies and how we've interpreted them at our school. And one of the key ones is social distancing, in line with the federal government. So outside of school, everybody is required to try and keep 2 meters social distancing. However, inside school, depending on your age, depended on the level of social distancing required. So children under the age of 6, there is no social distancing required between a child and an adult. That the carers, the teachers, the teachers' assistants should be able to interact naturally and work with the children and not be impeded by social distancing. Over the age of 6, there are elements of social distancing taking place in the classroom, and what we're trying to do is children can play together, but we're trying to keep them in class groups so we don't cross over our classes. So child and child can mix within a class, so there's 20 children mixing in a class, but we're trying to maintain social distance between the children and adults where possible. And we know with young children this isn't possible all of the time, and but I have to say the children have adapted to it really well, and they're doing amazingly, and you can see them actively trying to social distance. We have limited interaction with other class groups, so we've had to change the school, how we run classes. So children will stay in their classrooms as much as they can throughout the day, in that they're not going to different classroom spaces. But other teachers are coming into the classroom. So we might have a German teacher come into the classroom rather than the children all going to the German classroom. So we're trying to keep each group of children in their own space with their own germs and sharing that they're doing within their classroom. Any adult is expected to maintain the 2 meter distance, so staff are expected to maintain 2 meter distance, and children over the age of 14, we expect to see that. The only adults that are allowed actually on the school premises are those that are involved in the running of the school. We have no parents come onto the campus now, and no visitors at this time, but what we would allow is the photocopier repairman if the photocopier broke down, because that would be important for the running of the school. So some of the things that we have done at the school, we have staggered arrivals and departures over a period of half an hour. We have been quite strong with the parents and say you do need to be there on time, and they are doing really well. We are taking the children out to a pickup point, and the bottom photo you will see parents, they standing 2 meters apart, and when the teacher sees the parents, they will let the child go down the steps and they will join their parents there, and the expectation is that they leave the campus straight away. So as a community, we used to have a lot of children staying at the school and playing for an hour, 2 hours after school, and parents chatting, but we've stopped that. For those younger students who actually need to be walked to the classroom, we have set up some 2 points where certain age children, so early years, the 3 and 4 year olds, are taken to, and we have a group of teachers and assistant teachers who will meet them in the morning and then walk them into the classroom from there. So we have no parents coming into the building. Our teachers have taken the time to rearrange classrooms. We have removed some furniture. There hasn't been a whole lot of what I would say taped marks in classrooms. They're using other things like a rug, in terms of you don't cross over the line of the rug. So we don't have a lot of yellow tape in the classroom. I do have it here in the nurse's office. I like my nice clear lines. You stay there. We did have the smaller sizes for the first 2 weeks, and that was really important to help the teachers. And I think it helped the teachers more than the student, for the teachers to learn how they were going to work, how things were going to be, and to enable them to build confidence. What we have seen with the middle schools that have come back with a full class size is it's been more stressful on the teachers, and if in hindsight we would have done a slightly softer opening for them as well. We no longer serve lunches in the lunchroom. Children are now eating in their classrooms, and again staying in their groups. Our playground areas have been zoned off into 5 different playground areas with toys and things, and their class can go and play in the different zone. They get a different zone every day, and there are teachers out there monitoring and helping with play when they're out there. We talked about no moving around the school. Simple instructions to the teachers that even if they can't social distance 2 meters, that they maybe adapt how they talk to the children, so they might be side by side rather than face on face when they are talking to the children. We have closed our library. We weren't sure if we were going to have to do this or not, and we read quite a bit about the virus staying live for about 72 hours. And so we closed the library. All books are dropped off at points around the school. They are put in cardboard boxes, are left in these cardboard boxes, and just left for 72 hours before they are then opened up and put back out for circulation. We don't have children going to the library. Again, we're working hard to keep our class groups separate and not intermixing in spaces where there might be potential for crossover infection. In certain places around the school, we've put up plexiglass in reception, food services, though we're not using the food services at the moment, and different offices where we were unable to have people sitting 2 meters apart and they had to be in work. We still have a number of our staff who are still working from home. As I said, right at the bottom. Another key strategy is hand washing. So we gave the teachers some very strict guidelines on hand washing. Our school is a lovely school, but it's pretty old, and we don't have the best hygiene facilities and toilet and bathroom facilities. So what we did very quickly, you'll see we set up some taps and sinks outside, and so whenever the children come in from outside and when they arrive in school, they go past here, and everybody's expected to wash their hands as they go into the buildings. Any classroom that doesn't have a sink will have hand sanitizer. We're trying not to use hand sanitizer with the younger students, and trying to do soap and water, but sometimes needs must, and some of the younger students have to have hand sanitizer due to the restriction of the building. We have set times of when there's an expectation to wash your hands, which I've listed there. And it turns out to be about 7 to 8 times in the school day that the children are now washing their hands, which is better supervised or pushed by the teachers. We do have to send reminders out that this is one of the key priorities and ask teachers to do this, but this is just as important, if not more important, for the teachers that the children are doing this key strategy. Ventilation is another key point. They had quite a long document on ventilation. There is an expectation that classrooms are ventilated, and they mean opening the windows completely and fully for about 10 minutes. And they have certain techniques like keeping the windowsills clear so that you're able to do that easily. I would ask that we to consider the ventilation system. So our middle school building is a Minergy building, which is like a completely sealed building. And we questioned whether there was enough air circulating through the building to be safe for our students. And we have had that clarified this week that the airflow is sufficient, and so we can then go in and use the building. But that is one of the reasons why middle school stayed out until we had that clarity. And children are spending time outside where and when possible. So the school day for the children has changed a bit. So they're now spending 90 minutes outside during the school day. So 2 45-minute sessions in their zoned area with the class. The children love it. What we haven't been able to do is have classes outside because we've taken up a lot of the spaces with our zoned areas. There really isn't spaces to go and set up classrooms actually outside. But we would certainly encourage, we're next to a forest, and we would certainly encourage students to start going back into the forest, and they build campfires and things like that. So we would encourage teachers to do that. The big one, masks. So there's no obligation in Switzerland to wear a mask. You can if you choose to, but there is no expectation to. There is a recommendation, however, that if you are unable to maintain 2 meters social distancing on public transport, they would highly recommend that you wear a mask. We gave our teachers the choice, and we have said you are able to wear a mask if you want to. And we would supply our teachers with masks, and these are surgical disposable masks, and we supply them with 3 to 4 masks a day should they choose that they want to wear them. And I would say we've had maybe 20 teachers ask me for the masks, but actually consistently I've only seen 3 or 4 teachers consistently wear them because they are concerned for a family member at home. If you come in from public transport, and we give all the teachers masks that travel on public transport as well, as they come off the public transport, we have bins and hand sanitizers set up there and posters on educating them how to remove the masks safely. And they can have, if they want more masks, they can have masks. We have enough. We did have, as we went into lockdown, it was impossible to get anything. But in the last month, I have so many messages from companies saying, we've got hand sanitizer, we've got cheap masks, do you want to buy them? So the flow of goods has improved hugely. Students can wear masks as well. I've seen a couple of students around school. They tend to be Asian culturally. Their background of families that come from Asia is quite normal for them to be wearing masks, and those tend to be the students that I am seeing. I have seen students come off the public buses wearing masks as well. One of the things we did have to say is that because we are not requiring every student to wear a mask, we cannot monitor which students arrive in school with a mask or without a mask. So we had to inform parents we cannot monitor this during the school day. Other people that we supplied masks for, the cleaning staff, we've made a requirement. They have to wear a mask while they're cleaning. The kitchen staff are required to when they are preparing food. And for our bus drivers, they were to get masks. In my office, I have your standard surgical masks. I don't have any higher level than the disposable surgical masks. and I use them in the event that I need to get close to a child. And if I have a child who is sick and has a fever or not well, I have no problem putting a mask on the child as well. And we did ask parents to inform their children that this might happen if they come into the nurse's office and have said that they are unwell. We will put a mask on for them. And they will have to wear that until they go home. Cleaning. Federal government have asked that there are increased levels of cleaning within the school. What we have done is we have asked and made the teachers responsible for the classroom cleaning during the day. So we don't have cleaners going into the classroom. Again, we're trying to keep these closed groups of people. The teachers were asked to declutter to make cleaning easier. We've asked students to limit what they bring from home. We don't want lots of books and toys coming in and back and forth from home. And during the day, before and after snack and lunch, the teachers are cleaning the tables with just soap and water in the classroom. The electronic equipment that's used is cleaned with a disinfectant spray. At the end of the day, the cleaners are going in and they're using disinfectant in the classrooms. They are emptying the bins twice a day, and they are going around the school continually cleaning high-touch areas, banisters, toilets, shared spaces such as staff room, reception. But as I said, not going into the classrooms until the end of the day. And they're the cleaners' protection. Ooh, I've got to talk faster. Vulnerable students and staff. The Swiss philosophy, they have said that any child that was going to school before the lockdown is safe to return to school. So that includes diabetics and any child that was in school should return to school. Our children have had a choice, and so my one diabetic actually in the school hasn't returned to school until today. Today was his first day back, and that's fine for us. As you can see by our numbers, we have 89 to 90% return rates of students at this time. For staff that are in the vulnerable category, we have asked, they are required to produce a doctor's certificate, and if they have a doctor's certificate, then they can work from home, and we're very happy to have them working from home. Teachers are doing online teaching, and some of our other staff are unable to come into school, and I'd much rather that they stayed at home. Sicknesses, we have increased our sickness policy up to being 48 hours symptom-free if they're unwell. I understand the CDC recently increased that to 72 hours. I'm not going to change it at the moment. Our staff, our parents, and everybody have had so many changes that they are struggling to keep up with it. So at this time, whilst we've got no cases, they're really low in Switzerland. I think we had 11 cases of COVID yesterday in the whole of Switzerland that were reported. I'm keeping it 48 hours. If a child has been absent for school because of illness, they have to return to the nurse's office to be screened before they go to the classroom. And this is a simple temperature check and questioned, has your parent given you any medicine this morning? And if they have, we will explore a bit further. We are not temperature checking any children as they arrive on campus. We are not temperature checking parents. It's not recommended in Switzerland, and I would challenge the benefits of that. We have dropped our fever, our temperatures down a little bit. Normally I would say 38 degrees is a fever, but as you can see, I've dropped it down to 37.8, which is 100 Fahrenheit. If we have a child that's unwell, so if I had a child that came in here with a sore throat and a fever, I would be sending the child home, and I would be asking the parents to use a screening tool that's available on the public health site. And you go through it and you put in the symptoms and it answers several questions, and it will then advise you whether you need to see the doctor or go and have a test or stay at home. And you can do this as many times, so if more symptoms appear, you can go back and use that screening tool. If anybody is tested, we ask that that child and sibling doesn't come to school until we know the results. And in the event of a positive result, we will be informed as a school, and we will be expected to inform that class group. So if we have a student that tests positive, we will tell the other students that have been in that class group. The school will continue, the class will continue, but we inform them so the parents can keep an eye out for other signs and symptoms. In the event that we have 2 positive cases in one class group, our state doctor, our canton doctor, will make a decision on whether they will close that class and say to isolate for 10 days. And again, I put a link on the bottom there to our change in illness and fever policy during this time. We are required to have an isolation room or a space where we're able to isolate sick children. I'm very lucky, I've got a small room opposite me that they gave me. For me, it was very important that we're able to ventilate it, maintain 2 meters distance. There is almost nothing in there to help with the cleaning process, and literally a bed, a table, and a chair, and masks at this time. In the health room, I do have markings on the floor to help students understand social distancing. I will clean in between each children as they come in. I now have teachers calling down. So if they have a child they want to send down, I ask them to call beforehand. So if I have another student here, I might say, can you wait 5 minutes before you send them down, just to try and control the numbers here. We've given teachers first aid supplies so that they're able to manage the smaller things more effectively in the classroom, and really trying to keep well children out of the health office. As a school, they did very kindly allow us to increase the number of nursing hours as we went into lockdown. We had 2 full-time nurses here for the first week back, but we didn't need it, so I'm back to our normal nursing hours. I'm going to whiz through some of these so we can get some questions. Bus service. A lot of our bus drivers are over the age of 65 and fall into the vulnerable category, and so we made a decision, because they cannot return to school, that we could not run half a service. So currently our buses are not running. What we will be doing is there's going to be a plastic screen put up between the bus driver and the children behind, so when we return in August there is a barrier between the driver and the children. Sports and PE lessons could take place. Hygiene rules, wash hands before and after, but sports were limited to no physical contacts and trying to have low risk accidents as well, because we didn't want to put people in hospital, and the government have given us the list of preferred sports that they were doing. Food, no sharing of drinks, no self-service of meals and cutlery. We felt at this time, because of our space in our canteen area, we could not keep people apart or our groups apart, and so they are eating in the classroom at this time. And our hot lunch service stopped, and instead they supply a bagged lunch to those families that want to continue with that service. Therapies, so therapies within a school setting, the Swiss have said children should not be disadvantaged by not accessing therapies. So in our school we have learning support, and that takes place. We've moved those groups to a bigger classroom space so that they can keep the 2 meters apart. We don't have outside therapists actually coming onto our campus. But what we have done for a couple of teachers is supply these plexiglass so they can sit side by side as they might be working with helping a child on a much closer situation. music lessons, because of the way that we changed the timetable, music lessons were stopped at this time. There's a bit of an issue with, we know that singing and instruments that you blow through, that we need more space, and ventilation is really important. So for us at this time, music lessons have stopped. They are continuing online, so there are quite a few online music lessons still happening. Support for staff and students, really recognizing the mental health impact of this situation for staff and students. I would say the staff had a much harder time coming back and being released from being at home, and I think it was really helpful to have a day or two where they're able to meet people and set up and just start to interact with people and work out how they're going to cope with this. The children have just flown. We have had some children that we have concerns about, tend to be middle school or high school, and what we have been able to do, whether it's concerns for their mental health or their learning, we have been able to bring in small groups of 5 students. So we have had some smaller cohorts coming in over the last 3 weeks where we're able to connect with those children. One of the things that we did do is we reminded our teachers to stay alert to any concerns that they may have had. It's been a really hard time, lots of parents spending lots of time with children, trying to get them to learn at home, and with that, of course, conflict can arise. That's it. I think so. There's my email address, which you're very happy to email questions to. The document School Nurse Brainstorming, this Google group that I run, we had a meeting with about, I think it was about 60 nurses, where we sat together on Zoom and we tried to think of all the different things that we needed to think about within a school, and that's that document shared there, and I've put a link onto our school. Questions?
Thank you very much. We do have, before I start in with the questions, I want to let everyone know we have captured all of your questions, and you can continue to send those to us, and we will be happy to get the answers from Cynthia even after we are no longer with her online. So let me start with the first question. Sorry, I have too many mice in front of me here to work my 2 different screens. What made the Department of Health know that it was okay to reopen the school, Cynthia?
I think it was the data that they had seen from across the border in Italy, and the numbers of children with cases that they saw in Italy was within the European setting, I think was the first indicator. And countries like Denmark have done the same. And so there was this sharing of data. I certainly feel when they first came out with it, it felt a little bit like a best guess.
Thank you. When the opening of compulsory schools into groups with only 2 days and then opening primary schools, how did that affect the parents with children in both schools, and with the parents' return to work and need for childcare coverage?
Yeah, so it's been tough on the parents, and we've had a couple of parents who really challenged us as a school, saying that our local government said schools can open up completely, and you've gone for 2 weeks with this soft opening. We still use priority of safety, and that we felt this is the best way to go forward with that. There were only a couple of parents. It really weren't very many at all. Though the longer we went on, the louder those voices shouted. But we also have a lot of people very appreciative of the way that it's been opened up as well.
Thank you. Were there any data points that you used between May 11th and now that prompted the full opening of the school? or was that the plan from the beginning?
One of the data points was the number of students that came back. So it demonstrated 80% of the students coming back, that parents were confident, and we were confident. We were pushed by our local government that we really should be opening up fully. And so that was another point as well. But there was no specific numbers that led us to that, no.
Thank you. Are you seeing post-inflammatory condition in children that has been documented in the US and some of the other countries are seeing?
There's been 2 cases in Geneva, which is on the French part border, Switzerland, but they're the only 2 that I have read about. And as you've seen, there have been no deaths in Switzerland of children. I was speaking to a nurse in Denmark who had a child come into her office with what looked like chilblains on her toes. So she felt that she was seeing mild symptoms of that, but the child wasn't aware that they had ever had the virus.
How do you, this question actually I think you answered. How do you feed the children? Do they bring their own food, and do they eat in the classrooms?
So they eat in the classrooms, and I would say it's probably about 50-50. 50% of the children bring food from home, and 50% use the packed lunch service that the school is offering. We did send a reminder out to parents of, so children that had allergies within the classroom, food allergies, we sent a reminder out to those parents before we returned to school, asking them to help us and refrain from sending nut products, for example, into the classroom of these children.
Thank you. Is there any concern that the children might bring COVID-19 home to parents rather than the other way around?
Yeah, there is a bit of research, and I would have to go back and find it. I posted it on the Google group that suggests that, it came out last week, that suggests that children that are picking up COVID appear to have picked it up from the adults rather than in a school university setting. However, saying that, again, my colleague in Denmark, she's a couple of weeks ahead of us. She was telling me she had a student that had an accident, banged their head, spent a night in hospital. Anybody that spends 24 hours in hospital gets a COVID test, and this child's test came back positive. So they had no symptoms, they'd been in school all week, and but came back with a positive test. Now, whether that's the test or the child had it, I think we have to assume that the child had it at this stage, but I'm not so, I'm using that story to tell our leadership that I believe these groups that we keep our children in are really important in terms of the contact tracing, and that's one of our key things that we can do in keeping our community safe.
Thank you. Do you have children with medical conditions that make them high risk in your schools, and how are you handling them?
So we have a couple of children with medical conditions, but under the Swiss guidelines, something like diabetes in children isn't classed as high risk for COVID-19. Any child that has, so we have a young lady who's having some chemotherapy at the moment, we would advise them to talk to their doctor and take the advice from their doctor, and any child that cannot come back into school is receiving home learning at home. But interestingly, the child receiving the chemotherapy is in school.
Oh, okay. What about your staff? Do they have concerns? We have had many people express concern not for their own children, but for the exposure to the adults returning to school.
Absolutely. I think this is where most of the concern is with the adults, and certainly the first few days return back to school, there was a quite high level of concern there. One of the concerns from the teachers is that they want the parents to really understand that they cannot social distance from a 7-year-old when they've fallen over and they're crying and they need consoling. So that was one of the concerns. We do have those that are at high risk are not in school, and Switzerland has literally in the last 4 or 5 days added obesity onto morbidly obesity onto the high risk category, and so I've had to have a word with a couple of teachers because I need them to go and have a conversation with their doctor. The teachers want to be in school, but we as a school have a responsibility to keep them safe, and if they're vulnerable then they should be at home. But the majority, the teachers are having to follow the same rules of the children. So I might have a teacher come in and say, I've got a bit of a sore throat. No questions asked. They go home, they stay home until they feel better, and they have to be 48 hours symptom free before they come back.
Thank you. Are there any concerns about the mutation of the virus? Might the virus in Switzerland have different effects than the virus in the US?
My understanding on this is that they're already seeing some slight mutations, but it's not actually impacting on how the virus is behaving yet. So it's not something that's crossed my mind.
Okay. How about teachers of your younger children? You mentioned that they're not social distancing, but are those teachers wearing face masks?
2 are for reasons. One has a diabetic child at home, and the other one is the mother of the young lady having the chemotherapy. So those 2 teachers are wearing face masks.
Okay. What about special in-school instruction that not all children are able to participate in, like band or orchestra, for example?
So we have had to change the school day considerably, and so we have stopped the music lessons that were taking place and after school activities. So we don't have any after school activities because that would mean we're crossing over one class group with another class group, and certainly to the end of this school year we will keep our groups separate.
Thank you. How do you facilitate no parents of the youngest students, especially new young students for kindergarten? And what does that look like when parents of young children are separating from their child who's coming back to school, I think is where that question is going.
So for the youngest students, the parents are allowed to park their car and walk their student up until a point before the school buildings. We have a big yellow line there, and we have a group of teachers that are there and actually meeting the students. And I was asking a teacher today how it was going, and she says, it works so much better. We take the child away and we're off and we're doing something. The parent isn't staying around in the classroom, and she was saying she would like to continue that after this is all over.
Are you hearing anything from the parents about not being allowed into the school building?
No, but what we have seen is that parents are starting to forget a little bit, and they're arriving in the reception area for things that I would class as non-urgent. It really helps us that this is a federal guideline or requirement, and so we can be quite strict with this.
What about parents who don't come at their scheduled drop-off time?
They'll have a talking to. Those children will stay with their teacher, and obviously there are some parents that might have a child they need to pick up at 3:05 and one at 3:20. We would expect them to be there for the 3:05 pickup, and then to maintain social distancing. Again, parents are relaxing a little bit, and so we are telling them they need to social distance as well.
So even a week and a half, almost 2 weeks into it, the parents are not as strict to your rules as they were the first couple of days, it sounds like.
Absolutely, absolutely.
When your children are outside, are they playing on playground equipment? What are they doing for those 45 minutes they're outside?
So yes, we do have a couple of areas with playground equipment. They are playing on that, and we are not cleaning that. We are doing the best we can, but we're not cleaning the playground equipment. What we are doing is in the zones that are set up every day, there's different gym equipment like hula hoops and skipping ropes and blocks and things that they have. And these are being cleaned at the end of the day with soap and water by the teachers that are outside facilitating these zoned areas.
Thank you. We're going to have time for just a few more questions here before we need to wrap up. Is PE equipment different, and is that cleaned at the end of the day with soap and water by the teachers?
So at the moment, we are having no PE lessons. So this is, again, because of having to change the timetable around. So it's actually our PE teachers that are outside with the children for most of the day. And yes, the equipment they used is cleaned with soap and water.
Okay. Question to you, what changes have you made in your health office? You did mention an isolation room, and that's a question here. So
yes, I have an isolation room, and if I have a child with a fever, so we had one with a fever today, there were 2 nurses on today, so my colleague went and sat with her in the isolation room. She wore a mask. The child was 2, so we didn't put a mask on that child, but my colleague did, and she stayed in there until she was collected. If I was here by myself, I can't leave a child unattended, so they would have to stay in the nurse's office with me. And that's when the telephone calls down are really important, because I can then say, no, don't send a child down because I've got somebody who has some symptoms of COVID and I want to isolate them.
Great.
But other than that, in the nurse's office, I've got quite a lot of hand gel and disinfectant spray, and I'm probably now washing my hands about 40 times a day.
Cynthia, thank you very much for all of your answers to our questions and your willingness to speak to us. We are so grateful for your response to us and the information that you have shared. So for those of you who have questions that were unanswered, or you have colleagues who were not able to be here, this recording will be up on our on our VSSNA.org page, and we will obtain the questions to the answers that, let's switch that around. We will get the answers to the questions that have not been answered, and that, as well as the questions from today and the notes we've taken, will be posted. So again, Cynthia, thank you so much, and I hope you get to put your feet up this afternoon.
Well, thank you very much for the invitation. I really appreciate it. I'm sorry the presentation went on and on and on and on. But
do not apologize at all. It was very informative. Very informative.
Have a great day, everybody.